Hi, my name is Ramsey Badawi and I'm a medical imaging physicist and I specialise in positron emission tomography or PET scanning. 30 years ago I was working as the systems administrator at a hospital called St Thomas's Hospital in London, and I was helping out at the first clinical PET centre in the UK, and the physicist there was a chap called Paul Marsden, who was pretty junior at the time, although now he's a very famous professor. So he'd reached the stage in his career where he needed a PhD student, and I joined his team as a student, a graduate student, and I never looked back. And in 1998 I came here to the States to carry on my studies and research here. So the big flagship project that I've been involved with actually for about 20 years now is something called total body PET, and this is something I've been working on with my friend and colleague Professor Simon Cherry. And the idea is this: so a PET scanner really consists of sort of like a donut of radiation detectors, and a patient having a PET scan will lie on a bed and be pushed step by step through this donut, and the detectors can then make a PET readings of the patient, and you can get a picture of the whole body. And Simon and I had this idea that these PET scanners, which are about sort of 6 to 8 inches long, they're all very well, but they're limited because most of the patient is outside of the donut and you can't get any signal when the patient's outside of the donut. So what would happen if we made the PET scanner 6 feet long or 6.5 feet long enough that you could fit the entire patient in the field of view? And we figured out that if you did this, you should be able to get much better images, you should be able to scan much more quickly, and you should be able to use much less radiation dose. And so that's a pretty big deal. We touted this idea around, and we couldn't get any of the industry companies to really take such a big step and invest in this project. And finally, after 10 years, we landed this major grant from the NIH to fund the first prototype. And that was a different scene. Once we've got the NIH's stamp of approval, we then got much more interest from the companies. And there are now 3 major vendors in the world today that are all making scanners with this kind of design and selling them all over the world. The really cool thing about this scanner, well, there's a number of cool things about this kind of technology. One of them is that you can scan much more quickly and with less radiation dose, and that's hugely important for children. So young children can often keep still for a short amount of time, but trying to keep them still for the whole time it takes to do a medical scan can be very challenging. So this scanner, because it's so much faster, you can scan these kids and they can keep still for that amount of time, and you don't need to give them general anesthesia or sedation to do so. They can just do it after on being instructed, and that's a really big deal and makes the scans much safer. For adults, the images we get are much clearer, so that's a big deal. It can help improve the diagnosis, it can help improve the management of their disease because we know what's going on much more accurately. And then finally, the other thing that happens with a scanner like this is you can make movies of drugs moving around the entire body, which is something that had never been possible before. And there's lots of crazy science that you can do with that. So one of the things that we're working on is we're looking at using this technology to tell if a patient who has fatty liver disease, and there's about 60 million people who have fatty liver disease in the US today, to see if their liver isn't just fatty, but whether it's also got inflammation. And there are about 10 million people in the US who have inflamed livers. And if you have an inflamed liver, then you really need to get on it much more quickly than if you just have a little bit of extra fat in your liver. So that's a pretty big deal. And the other thing is that since we can scan the liver and the brain at the same time, we can also examine the brain. And what we found is that we can start to see changes in the way the blood-brain barrier, a big functional part of the brain, how that is changing with respect to these disease states. And that's all pretty new. We're still working out what the implications of that are. But we think this could have major implications for the way we treat not just metabolic diseases like obesity, but also heart disease, and maybe even lead to greater understanding in the realm of Alzheimer's disease as well. I came to the United States from the UK, and a big reason why I came here is because the healthcare science environment was so much more vibrant here than it was back in the UK back in those days. And the primary reason for that was the NIH and the investments that it made. Now, total body PET has created essentially a whole new industry. But without the kickstarting of the federal healthcare dollars to really turn that idea into practice, I'm not sure it would ever have happened. And I think that's true for a lot of these new ideas in healthcare. The thing is, the big companies that need to invest in them, typically, for the most part, they're quite conservative, and understandably so. But what that means is these new ideas are likely to stay on the drawing board unless the federal government steps in and starts helping out to kickstart them and get things moving. So I fear that if we don't have that, then that's just going to be a real shame, because these new developments are not going to be there to help our sick kids, cancer patients, and folks with Alzheimer's disease.